I worked for you at the chamber. I've been here since November, I think. And I've gotten around to meet most of it. This is Heather Elliott. Heather's with Holland out of Benton, Mayfield, Paducah, and elsewhere, right? All around. And she'll be presenting today, talking about the Affordable Care Act, or Obamacare, as most people call it, as it applies, I think, to employers of less than 50 people.
Well, we'll touch on.
Whatever you got. But let's, for her information and mine, I'm not gonna put myself on the spot today. Let's go around the room. Just start out here. You mouse school, you're getting started. Let's introduce ourselves here. And let me get started first.
I'm Heather Ward. I'm the Marketing and Mission Director at Christian Care Catala.
I'm Cindy Britton, and I'm the Administrator at Christian Care Catala.
I'm Wayne Butts, I'm on Farm Bureau.
Leslie Pate, Farm Bureau. Amy Rondon, Buchanan Floors and Chamber Board Member. Kim Shoulders, Chamber Board Member, and I work at Rivers Bend Retirement Community in Human Resources.
Justin Lab, River Smith, the administrative leader. Gary Driggers, and I'm the candidate for District 1 Magistrate.
Jerry Aldridge with Travel News, and I'm a board member.
Julie Stout, Henry Monuments.
Joanne Vogel, Holland Regional Glass.
Nancy Slayton, Neighborhood.
Robin Gray, Farm Bureau.
Danny Patton, Farmers Bank and Trust.
Mike Teller with Patty's.
Robin Allen, Human Resources at Patty's.
And
Jim Stott, Chamber.
Jim Stott. At this point, Heather, it's all yours.
Glad to be here today, and I appreciate you guys inviting me. Always a pleasure to be able to talk about healthcare reform. I know not everybody wakes up in the morning thinking this is the first thing they want to think about, but unfortunately, if you turn on the news, there it is, and you know, we're going to hopefully dispel some of the misinformation that's out there and be able to actually give you some of the facts today and some of the changes that we expect to happen this year. To give you just a little bit of background about me, I've been with Holland for the last 5 years. I started my career in insurance about 7 years ago. Some years before that, I was widowed at a young age, and I realized through that experience what an important part insurance can play in someone's life, and you just never know when you're going to need it. So I got into insurance to be able to help others that maybe were hard-headed like me and thought they needed to cancel an accident policy or they needed just not very much life insurance. So that's how I got started in insurance independently, and then Holland was one of my contacts. I worked on the carrier side, and whenever I met Roy and Greg and Keith, they kept on and on asking, when are you going to be interested in working for us? And that's when I started entertaining that idea, and I've not regretted it a day since. It's been the best decision that I've made. They're a wonderful group of men to work with, and very sincere in their business. So I'm glad to get started. Okay, I feel like we can't start at the end of where we're at now in healthcare reform without having a reflection back, just because so many things have built upon each other. And if you think back, like in grade school, whenever you started that first 2 weeks in August or September when you started school, and how you did, just the same thing you learned the year before, and you get tired. I always got tired of the review, but it almost is necessary for you to be able to catch up with where we are now. So thinking back, March of 2010 was when ACA was passed and signed into law. There were some changes that happened that year. Most of the things that we saw happen were for the better. Coverage for children with pre-existing conditions, that was really unfortunate that kids before that, if they not had coverage, could have been caught in that, so that was a good thing. Coverage for young adults up to age 26. So that just meant that on the parents' plan, they could keep their children on there until age 26. There were no more lifetime limits, which we didn't run into that really being a concern very often at all. Very, very few self-funded plans had limits that were low enough that a person would have ever reached those. But there were some plans out there. We were fortunate in the state of Kentucky that we have a strong Department of Insurance, and they do a wonderful job of making sure that the policies that are offered are quality. So we really didn't have that problem so much in the state of Kentucky, but we did see those in other states. We have clients in, I think, 30 of the 50 states, so we did see that in other places. Cancellations, rescissions, those weren't, again, a very large concern here in Kentucky. It changed. We already had an appeal process, but it did change the appeals process, not something that was very significant. the Consumer Assistance Program, a small business tax credit, and that's something we've already had a question about today. That's something that we'll talk about again later, but that's whenever the small business tax credit first became available. And the temporary coverage for people with pre-existing conditions. In Kentucky, we actually did not use that program because we still had Kentucky Access. But in other states, that program was used, and some states had a high-risk insurance pool that they decided not to continue, like in the state of Tennessee. They decided to use this, which wasn't the best thing because I actually helped a friend of mine that needed coverage, and because she lived in the state of Tennessee and they didn't have a Kentucky Access like we do, we finally got her on this plan after 4 months of working on government red tape. We finally got her enrolled in the plan, and then the next week we got an announcement they were no longer accepting enrollees, and basically, you might get your claims paid or you may not. Fortunately, that was a temporary solution for her. So that was 2010. 2011 did not see very many changes at all, and I think that was in the design, just that it was a political year, so we didn't see any changes. The largest, or the most significant change, I would say, is the medical loss ratio. Did any of you guys get refund checks? Have you gotten any from loss ratio? No, had been a few, and most of the time it was very insignificant amount of money, and by the time you went through the formula to divide it out to find out who's supposed to get the money, if your employees paid part of the bill and they were due part of it, or you could apply it to premiums, but what if somebody didn't work there anymore? By the time that you sorted through all of that, I mean, most people were getting $5 and $6. The largest one I probably saw was about 50 to 100, so. But again, we were regulated in our state where the insurance companies, this just means that they pay out 80% of the claims on a group that has less than 50 employees. 80% of those dollars, or 80 cents of that dollar, goes towards claims, and 20% for all administrative or any other marketing type functions. So it actually is 85% on groups that are over 50. So okay, so 2012, even fewer things that happened. Again, thinking about the political climate and how this was designed. 2012, we had added services, preventive services for women, some changes there. As you guys may have seen in your insurance renewals, there's an extra notice that was included and will be for forever, I think, because of that. But also summaries of benefits and coverages, and if you guys have renewed since October of 2010, you've given these out to your employees. Most of the time, if they're printed in color, they're blue, they all look in the same format. It does, in my opinion, make it very easy to compare policies. So if you have a spouse and you have your plan and you can look through there, you can really compare those. But also on the employer side, it allows you to be able to compare the summary, in that summary, to be able to compare plans to help you decide what to offer for your employees. And again, that's really where your perspective probably is. 2013. We had the exchange open enrollment begin. If you guys remember last fall, everybody had to give out the exchange notices. Either there was a notice for if you offered a health plan or a notice if you did not. I've just been going around reminding all of my clients as I see them again this year that they need to remember to give those to new employees, because everybody, we preached it, sent out I don't know how many emails and webinars, and every one of our seminars mentioned it. But we also want to make sure that you're giving those out to new employees. And if you have any questions on any of these kinds of things after the meeting, I'm glad to answer those and email you model notices. But this one in particular is available on the Department of Labor website too. So, okay, so this is the big year. This is the big year. In 2010, whenever healthcare reform passed, 2014 was the year, and it seems so far away, and it's gone by so very fast. So our coverages began for the exchange plans January 1st. So we're getting feedback so far. The plans that have been enrolled, you may have heard some of the hype, and there actually should have probably been more on the news about the plans and the limited networks. While Kentucky Health Cooperative was a cooperative set up through a grant that's funded for 3 years through ACA, that network has right now the most number of providers and hospitals in our area. Anthem chose to use a very skinny network where there are several hospitals in our area that do not participate, as well as several physicians. And if you go outside the state of Kentucky and you have a plan that you purchase from the exchange through Anthem, you do not have coverage unless it's an emergency. So I look for there to be some big repercussions as we go forward. But the way it was written, they only had to include 20% of their provider network. There is legislation in play right now to make that 30% of their provider network, so that's still, we'll still see where that goes. But again, it was a good thing for those that had not had health conditions, that they weren't able to get covered before, no pre-existing, so you sign up January 1st, you've got it. And you know, you hear on the news where they talk about, well, why would I buy insurance? Because I can just go get it any time. It's a guaranteed issue, no pre-existing. It's not exactly true. Because the open enrollment period only runs from October going forward. This year it is open until March 31st. But going forward, it will end at the end, well, it will actually end for January 1st coverage. It will end December 15th. So you only have that window of October to December to get enrolled, just like similar if you've had anyone in your family enrolling in Medicare, you've got that open enrollment window. If you don't meet it, then you're out until the next year. So then it will be the same way, because the carriers have to protect themselves from adverse selection and someone waiting. I mean, common sense, you wouldn't wait until your house is on fire to go to Farm Bureau to get some, to get some homeowners insurance. That just doesn't work that way. So that's the way that the carriers can protect themselves. You have the open enrollment period. Yes.
They extended the coverage for my business until November 31st. So if we enroll between now and then, and we don't, or after March, say we try to get it in October effective.
Businesses operate on separate rules, and I should be, to make that very clear, this is just for individuals. So just individuals that choose not to be covered at their employer, don't have it available. This is only what I'm speaking about now at the exchanges. That's on the individual side, and that is a very good clarification too, because you can enroll small businesses in the shop exchange. We've tried, and I'll be honest, we've tried with a few clients so far. It's not been the best option for them, but not to say that it isn't a good fit for someone. But
Well, if you go from business coverage to personal, are we going to be without coverage until January 1st?
no, because that would be a qualifying event. So without a qualifying event, they could not enroll in the exchange in the individual plan. But if they do have a qualifying event, then you could, or you could go direct to like Humana or Anthem, same way as always, and get an individual plan. You're right. If you lost coverage, like if the employer, as an employer, if you terminated your plan, then all of those employees would be eligible to enroll in exchange. You're right. Any other questions? Please don't be shy to ask. It's like I say, we live, eat, and breathe this, but if I don't make something clear, I would much rather you ask than to be unsure. Those that enroll in the exchange that qualify for subsidy, which that is between 138% of federal poverty level, all the way to 400% of federal poverty level. Now, with that being said, as you increase income, the subsidy decreases. But at the very lowest level of that 138% to about, I want to say it's 200%, you are eligible for savings on your monthly premiums, but then you also may be eligible for savings on out-of-pocket costs. So for some employers, their employees were better off for them to not have health insurance as an employer, but for the employees to be able to go to the exchange and be able to buy it themselves. So that's something that we've counseled with clients, and we just look at this. Every group that I've seen is just a little bit different, and depending on what your situation is, for some that was the best option for their employees to get coverage. Kentucky was a state that expanded Medicaid, so all the way up to 138% of federal poverty level is eligible for Medicaid. Now my concern there is, who are they going to go to? The provider list is very, very small, and even the providers that accept Medicaid that are on the list of providers limit oftentimes the number of patients that they see in a day that are Medicaid patients. So you'll probably be hearing about that. The no more limits, yearly limits on coverage. That's the expanded small business credit. The expanded small business credit actually means that they extended it. If you say, I had a client that took advantage of the small business tax credit from the very beginning. Perfect scenario, 9 employees, nobody made over $50,000 except for the owner, and you exclude yourself, so it worked out great. He took advantage of that credit. He gets to continue to take advantage of that credit as long as he buys the insurance through the shop exchange for 3 more years. However, that wasn't his best option, but like I say, that there's a small window of employers that is a wonderful tax credit option, and I just caution to talk to your CPA and if you think you may fit in that, to make sure. Because you have to make sure that you don't have common ownership with other companies. You know, there are some tests that they have to run through to make sure that you're gonna qualify for that. But if you do, it's almost like providing the employee insurance at no cost, because you get up to 50% credit, and you don't have to pay 50% of the employee's coverage to meet the contract with the carrier, so. Any questions on 2014? Okay, so looking forward for 2015, which again seems like a long way away, but we'll blink twice and it will be here. The player pay, if you notice I changed this slide, because when we gave this, the last time I gave this presentation, it was still 50 full-time equivalents. It's 100 now until 2016. That was a very, very recent change in the last couple of weeks with the postponement of the payer responsibility for those employers that were between 51 and 100 or 51 and 99. They're not going to have to pay the penalty this year. It's only over 100. And it's full-time equivalents, so we'll talk about that too. The first 30 employees, they don't count in the penalty, so they give you a little bit of free there. And then common ownership and common control, that's something I just was mentioning. Just make sure, and sometimes I don't know, I have one employer with 3 employees on his plan, but he has over, 100 employees total. But it just happens to be that he's a lot of part-time employees. So making sure that you're talking with your agent or broker, that whoever you're working with, that's your advisor, to make sure that there's not common ownership that's pushing you over that 100, which is a lot bigger number than the 50. The 50 was really a concern. And since they postponed it to 2016, my personal opinion is that it will stay that way, that the definition will be pay or play over 100. If you don't provide health insurance, again, that's a penalty to the employer of $2,000 per employee over that 30. That's full-time equivalent. If you offer coverage and it's unaffordable, which if you offer health insurance and it to be unaffordable, generally, from what I've seen with our client groups, there may be 1 or 2 employees that make minimum wage and work right at 30 hours that are in that area where it's unaffordable if they're paying more than 9.5% of their total pay towards just the employee-only coverage. So just to kind of touch on that pay or play. Do we have anyone in here that has more than 100 full-time that you know? And you guys probably have a lot of variable hour and all of that to concern too, but just want to make sure that everyone else is not concerned with that. Okay, so then talking about recent things, recent changes that happened in the last quarter of last year, or just in the last couple of months now. Of course, the limits were released as far as highly compensated employee. This is something that comes back under discrimination testing, which we were talking about this yesterday actually with the carrier, because in the past, I doubt that 5% of our groups do discrimination testing on an annual basis unless they have a 401k. But the ones that don't have a retirement account, I seriously doubt are doing any discrimination testing. And there have been 60 new auditors approved for Kentucky, out of Fort Wright, Kentucky. They've hired 18 of them, and we're seeing them audit groups as small as 8 employees. So I don't know the rhyme or reason or why. I mean, some of that is attributed to if you have an employee make a claim that they think they were unfairly treated, but it can be something as small as I didn't get my summary of benefits and coverage, or I didn't get my exchange notice that triggers that. So I just want to make sure that we're complying on everything that we know to be complying on. And the highly compensated employee factor goes into the discrimination testing to make sure that that's not the only employees basically that participate on your plan. There's the adoption increase, age-banded maximums for long-term care. Not something that's mentioned that often. The biggest thing on here is, of course, the HSA and the high deductible health plan minimums. So they did increase from 30 to 50, so they increased $50 per year that you can put into a health savings account if you're an individual, and $100 if you're a family. So that increased from $6,450. So the deductibles minimum, you only have a $1,250 deductible for individual to have a health savings account, compatible plan and the out-of-pocket maximums still have to be within that range. Okay, still flexible spending accounts, you can't put more than $2,500 in there. Dependent daycare is stayed at $5,000. Luckily, they haven't changed that one, so still. That was any questions over? Okay. So there was some wording that did not match between ACA when the law passed of what preventive care was, and if anybody offer health deductible or high deductible health plans already in their employer base, the high deductible health plans had wording, you already had preventive care paid. But some of what they paid for wasn't what ACA said they had to pay for, so there was some discrepancy there. This is just saying that they ironed that out. So that the HSA, and the other problem was with the Affordable Care Act, it stated that you couldn't have any first dollar coverage if you had a high deductible health plan. Well, we already had preventive care, so some of that was worked out so that met ACA. The individual mandate, back to that. So the individual mandate is in play right now. If someone doesn't sign up by next Friday, they're going to have coverage as of April 1st. They're not going to have coverage unless they have a qualifying event to be able to qualify them to enroll in individual coverage for the year, and they'll be paying a penalty. Say someone had an employer plan and their plan renews in June, and they didn't participate last year. They come out and said now they have until June of this year and they will not pay the penalty for the first 6 months. Now, I have no earthly idea how on earth they can track that. They still are working on the IRS forms to be able to even know how to track the individual penalty. So we'll see how that works out. I just know that they've allowed people to wait until their next open enrollment. Even though last year, the employees that went ahead and signed up didn't think they would have that opportunity, and some of them may wish they'd waited. Okay, HRA's health reimbursement arrangements, which a lot of times I'll have a client that'll have, say, a $5,000 deductible, and the employer funds a health reimbursement arrangement for the first $2,500 of that. So if someone has a situation like that, that's called integrated with the medical plan, and that's okay. We can still do that. There are some things that we need to make sure the wording in the plan documents and such are compliant. If you have a health reimbursement arrangement, on the other hand, where employees are just using that money to pay their own premiums for individual, we can't do that anymore. Or if they were using it for medical expenses, say you just gave everybody, you didn't have a health plan, but you just gave everybody $3,000 a year on a debit card with a health reimbursement arrangement. We can't do that. If it's not integrated with the health plan, you can't do that any longer. So if you have a health reimbursement arrangement, an HRA or a FSA that you don't have a medical plan, then you need to be speaking with your advisor, because we can't do that any longer. If you have flexible spending and you have a medical plan, that's all great. There are some rules, there are some situations where you can have flexible spending without a health plan, but just make sure that you're talking with your advisor on how to manage that. Because those are changes. These changes actually were announced, the guidance was announced, I would say probably late September, because I already had enrollment systems built for large employers. We already had all of their plans in place, had everything scheduled, benefit books printed, everything in hand. So it was very last minute, and I think probably I still have employers that, even though we've tried to find out, does anybody have one of these style plans, there'll still be, oh, well, we've always been doing flexible spending, we've just been administering it ourselves. I mean, we need to make sure your advisor knows that you have those kinds of plans, so that everything works together and we don't have any issues. Okay. So, and this is, again, talks about some of the provisions and some of the things that we have to do to make sure that those are compliant. I have to read all of that. So for reporting, and this is some of the paperwork that they're trying to, actually the public comment session is open right now on some of the IRS documents on how to report as the employer that you offer a plan, as well as for the individuals to be able to report that they have qualified coverage. So that's in play right now. Again, I updated this slide there in bold. Large employers are now defined 100 full-time equivalent, and that's postponed on the 50 to 99 to 2016. We'll see, at that time if they postpone it longer, or if they just say it's always going to be 100.
Are you saying if you're a large employer with 100 or more, that you're gonna start paying the penalties this year?
On 2014, but you wouldn't pay until 2015, but yes.
So, is what you're saying, they're supposed to pay monthly, they're gonna give you a bill for 2014's January, to be paid in January of 2015?
Well, it would be with tax filing for whenever you would file taxes on 14, if you didn't offer a plan.
So they're now looking for it to be paid all at once, one lump sum for the year?
I don't know the answer to that. I don't know if they know the answer to that. And, you know, they said whenever, which I brought a couple of, well, a few copies of the final pay or play. So anybody that wants that for over 100, and it probably goes into more detail on the payment, but I don't know that it goes into that much detail as far as how to pay it. But it did say whenever they released that, and you guys may have noticed that it said if employers reduce their workforce they say that you need to be certified that you did not reduce your workforce or to be under 100, or that you didn't make major changes to your plan, or there's some wording like that. But our question back to them is, okay, well, where do you get certified? Who certifies that that's what happened? We haven't had an answer to that yet. Okay, so individual, back to, I know we're going employer side, individual side. So if individually, someone chooses not to have coverage, these are where the penalties start, and it's for 2014, but it will be reconciled at tax filing, because that's how they've set it up. Where it will either be a penalty of 1% of income, or the minimum, the $95 per adult, half of that for children, or up to $295 for starting at $295 family. But 1% of income for someone making $50,000 is $500. So still, the penalties start out rather low for the individual side. As you see, the next year they do increase 2% of income, significantly higher per adult, child, and family. And then 2016, it steps up again. So, but the penalty cannot ever be more than the bronze plan. And I don't know if you guys have looked on the plan summaries or looked on, I'm sure, I'm the only one in my free time that looks at the website to see what the plans look like. But that bronze plan, it's terrible. It's almost a $5,000 deductible in most cases to be a bronze plan. You would be bankrupt before, even if you're a successful person, it would almost bankrupt you before you would ever get any coverage. And if you think about the people that are most likely buying those minimum plans, there's no way. The only thing they're gaining, they are gaining preventive care that they wouldn't have had before. Preventive care is paid 100%. But I don't see a lot of value other than that on the bronze. If you step up to the silver, it's significantly better. Okay. But the point is, on that I want to make on this slide, the individuals are paying that penalty and they still have no coverage. So if there is an opportunity for them to get it, which I heard yesterday there was 4 million enrolled on the exchanges. I don't know I don't remember what the total number was that they expected, but there's definitely a lot more out there eligible for subsidy. Okay, so this is talking about how long, the 90-day waiting period, just talking about how long employees can work for you before they're offered insurance. And again, there are some ways around that. If you have a lot of variable hour employees and you're tracking those, say you hire somebody and you don't know exactly how many hours they're going to work, if you truly know they're going to be a full-time person, then you know you need to go ahead and start counting for your waiting period. If you know that you have someone that you hired in part-time, they work 20 hours a week, 25, 28, 32, or that's the variable hour employee that you're going to be tracking to see all the way to the next year if you wanted to offer. If you see that same person is a great worker and you want to keep them and you want to use it as a tool to be able to use it for retention for that employee, you can go ahead and offer coverage, bump them over in the full-time category, and that's all good. So there are some ways to get around just offering coverage to everybody that works over 30 hours. There are also provisions in there if you have an employee that works less than 6 months. They did say 120 days. but they came out now and said 6 months. If an employee's seasonal, working less than 6 months in a year, then you don't have to offer coverage to them. You can class them as seasonal. But if you have true full-time employees, the guidance is 30 hours per week. They're eligible for health coverage. Doesn't mean they have to be eligible for vacation or other benefits that you offer, but the health coverage, that is the rule on that. But you can't make them wait longer than 90 days to be able to offer that unless they're a variable hour in that situation. So if you have somebody that, say you've always had it first of the month following 90 days, at your next renewal, your options will be one of the following. You know, obviously you probably maybe not want to go back to date of hire, but most commonly I'm seeing people go with first of the month following 60 days, just because for accounting purposes, that way you're not dealing with prorated premiums, where somebody comes on the bill for, comes on your plan for 8 days, and you have to prorate that out. So most everyone is gone with the first of the month following 60, but you would have the option of waiting until 90 days if you wanted to. Any questions on that? You guys probably already have all changed yours. I had a few that waited as long as they could. Wellness. Does anyone here have a wellness program? I know Danny does. Anybody else? Wellness program. Some guidance came out on whether it's a participatory wellness program, in that if they say they do it and they drink water, say, those kind of campaigns, or if it's actually on result based. So the health contingent wellness, and also provided that anyone that needs to be able to have a reasonable alternative. So those are some things that I think we will see a big insurgence of wellness plans, just because that is a way to, number one, control your premiums and your claims. I mean, that's something, bottom dollar net savings there, and then also to be able to offer better premiums for the employees that do try to participate and take care of themselves. Okay, so we have a session called Inform on Reform, and we just had a webinar. The February 19th session was on COBRA, and then we have one coming up March 19th on kind of catching up on ACA so far this year. We did plan to have an in-person seminar in May. All of these things are, no charge, and that's something that we are doing as community service. I wanted to just let you know that we have that available. Again, if you have questions after, I'm happy to answer those. If anybody has public questions that you're not afraid to ask in front of the group, we certainly can address them. I hope I'm not seeing a lot of glassed over eyes. I think you guys were pretty well informed, seem to follow along well.
Questions? I got so many, I don't even know where to start.
Well, maybe we need to, and I'm happy to sit down with you guys and go through those too.
That's probably
Let me raise a point, and it's probably insignificant, but whether you're an employer who offers health care protection or not, there's still notice requirements, correct? In other words, you have to tell your employees that you do not offer health care protection.
And that comes back to that exchange notice. If you don't offer a plan, that exchange notice says at the top, for employers who are not offering a plan. But that all new employees would get that, and it would just basically be directing them to the exchange. If you have a plan, then you have to give out that notice. That's a different notice that says that you do. But yes, you don't get out of the notice requirements. The bad thing is you don't get out of the reporting requirements if you don't have a plan either.
So it's a burden on all employers regardless.
But I don't know how much yet, because they're working on the forms. But again, that is something else that you just made me think about though. If anybody has a health reimbursement arrangement plan or flexible spending, there was a separate filing form for the IRS. It's called PCORI, Patient-Centered Outcome Research Institute. That's what you hear about everybody saying the death panel, but what that actually is where you pay a fee per year. Last year it was only $1 per average member, so your average number of employees that had a flexible spending, say. You had to pay that in by July of last year. They haven't updated the form yet for July of this year, but that will be something else that, it was supposed to have been filed last year, but a lot of people didn't know that or do that. So just make sure if you have flexible spending or health reimbursement arrangement, those are seen as separate plans. Of course, if you have a self-funded health insurance plan, then you're going to pay that fee. If you're fully insured, the insurance company's paying that fee. But for a lot of employers, those other plans like flexible spending and health reimbursement those are independent, and the third-party administrators, even if you have somebody that's managing claims and the debit cards and all of that, most of them do not offer that assistance to file that form. It's called a 731, I think. I can get that form to you, or the link to the IRS site. Like I say, it still says 2013 on it, it's not updated.
If you have 100+ employees and you have to pay the penalty, it's $2,000 per employee per year. What is the basic cost if I wanted to supply healthcare for each one? Is that $5,000, $6,000 per
Well,
person?
sometimes it's no cost. That's what I have a proposal on my desk that I got in yesterday for an employer that, you know, that they're not gonna offer a plan until they're in that 50 to 100 range. They're not gonna offer one until they absolutely have to. But there's a 100% voluntary employee plan that the employee buys it. So, I mean, there are options there. That's a minimum plan. I mean, it stinks, it's not good coverage, but it does meet the requirement, and it's probably better than nothing. But there are options there for the employees to buy it themselves and offer it under a group, or for you to do a minimum. If you did a minimum plan, I mean, those bronze rates, I really would have to look. I mean, but they're shelf rates, so I can pretty much tell, you know, a range. The thing about it is, over 100, you're still risk rated, and that is a big difference. You know, like always in the past, you had to, if you wanted to check insurance rates, you had to fill out all the applications, we had to wait, we get numbers back from every carrier, and we had to come in. Now, if you're under 50, the rates are the rates, unless it's an association that we're using to get those rates. So it's only the over 50 that we still have to do some risk, they still do some underwriting and some risk rating. So that's why those rates wouldn't be just set in stone, but I would have a real good idea based on other groups with similar demographics.
What is the latest procedure in figuring out how many part-time employees you would want for?
And that's something that we'll be addressing in one of our sessions upcoming too. We did a little bit last year, and we saw a lot of eyes glaze over, but that variable hour tracking, you have a measurement period, so you have your measurement period that you track those employees, okay? Then you have your, what they call, it's basically open enrollment for like 2.5 months, the open enrollment period, and then you have your stability period. So for that stability period, you wouldn't have thought about that before as a plan year. So for that 12 months, it's locked in. Whoever was on the plan, offered on it, whoever wasn't, unless you have new employees, but just say existing employees. But during that measurement period, you've got time to track those people that work different amounts of hours, look back up to 12 months, look back. You can do a shorter time, but you can look back up to 12 months and say, I average over 30 hours. If so, I need to offer coverage. But if they didn't, then I mean, you're not paying penalty on your real part-time people. You're not paying penalty on those that are in that measurement period. You're only paying penalty on over 30. You get the first 30 free of the ones that are true full-time employees. So when we looked at it last year, I had probably 3 or 4 groups that really looked at it seriously last year, and then that was postponed. And it was going to cost them about the same to pay the penalty, because again, that penalty is not tax deductible, it's excise tax. But for running a plan is deductible, it was going to cost them more to pay the penalty than it was to offer a plan. Now we haven't pulled the trigger because now we don't have to, except for on one we do. But they're just sitting right there at that line. We had a lot of part-time employees, and we track those and all that good stuff. So we will be talking more about that, and I'm happy to meet with you guys to do that too. More specific to you.
If an individual isn't covered by a work plan, or plan where they're working, and they fail to buy insurance, and they're susceptible to the fine of $95 or $295 or $235, whatever it was per family, they just fail to pay it. What recourse does the government got?
If they don't have a tax return, they don't have any recourse right now. If they have a tax return, they take it out of that.
Well, aren't the same people that would be in that position, people that are likely not filing tax return?
They probably are filing, they're probably getting unearned income credit, so they would take it out of that for the most part. I mean, but same way if someone lied and said they estimated their income for 2014 to be $20,000, and they're one person, so they got their plan free on the exchange. If this year they make $40,000, they don't have a tax return, they don't have any way to get that money back. Because if you do lie, or if you just are very fortunate and you make twice as much as you said, and you signed up for subsidy, then they're gonna take that money back, you owe it back. On the flip side of that, you have a choice not to take that subsidy, and then at the end of the year, if you would have qualified, then they will include it on your return. So that's why I said there are a lot of changes coming to the IRS, and I'm not sure that they will have all those made by this time next year for people to file their taxes, but we'll see. The one thing I do know that was startling, I knew that we had a client in Western Kentucky that had gotten an audit letter from the Department of Labor. But they have probably over 50 employees, but the 8 employee count, I mean, that was a little bit startling to me that the Department of Labor would even take time to do an audit on an employer that small. But just making sure you have your plan documents in place and everything tucked away and compliant. And there are services out there that do just